Hello, this is Rini. Today I'm going to talk a very serious topic, breast cancer, which is the top cancer in the United States among women. Let's know about how to prevent it. Begin with a few examples. Can I ask you a question? Who has more tendency to development breast cancer? There's 5%. One is a mom refused breastfeeding her newly born baby. Or a lady taking birth control pills doesn't want to get pregnant before age 40. A middle-aged nurse has been through emotional trauma like divorce. Or an overweight girl takes birth control pills to treat her dysmenorrhea. Or a flight attendant is taking HRT hormone replacement therapy for her perimenopause issue. You may couldn't answer all the questions and couldn't figure out who it has more tendency. Let's begin from the mechanism. Estrogen. Women couldn't live without estrogen. Estrogen can grow breast cell, can grow uterus lining for a period for fetus, has more function in brain, lung, heart, bone, and skin, etc. That middle-aged menopause lady maybe have lower estrogen, so they feel they're losing memory, or they have a lung heart problems, or their bone density decreased, or they have a dry skin. Where estrogen from is from ovary. Maybe everyone know that, but maybe you couldn't know liver, adrenal gland, and fat cells can produce estrogen too. Let's talk about ER, estrogen receptors. Estrogen and receptors like key and lock relationship. Organs like ovary, uterus, breasts have estrogen receptors. And brain, lung, heart, bone, skin have those receptors too. Breast cancer high level of estrogen is an important pathologic reason to trigger off breast cancer. Let me explain in detail. Why some people have higher estrogen than the others. Some girls have early menarche. Generally in the United States, a girl like 12 to 13, they maybe have the normal first period. But people like younger than 11, they maybe have early menarche, and they maybe have a late menopause, like older than 60 years old. Generally, lady around 50, they maybe have those menopause process. But older than 60, it means late menopause. Or some lady giving birth to their first child in late age or no breastfeeding. That means the higher estrogen in their body. Maybe the estrogen comes from outside, like taking hormone pills. A teenager girl have acne, they may be using birth control pill to treat her problem. A young girl have period cramps, taking birth control pill too. And a lady really want to have a birth control, they're taking the pills too. In middle-aged lady, maybe they suffer from menopause syndrome. The hormone replacement therapy maybe reduce her variety of symptoms. Or old lady have a dementia, loss of memory, and they use hormone therapy to let her get better. Emotional changes like psychological trauma. I talk with a lot of people have breast cancer. Some of them lost their beloved. Some people have a very bad relationship. And some people have an economic issue. And some people lost their son or daughter. Later, they will be get pregnant, breast cancer. So I searched a meta-analysis that lists like 10 risk factors The second major risk is psychological trauma besides benign breast disease. I think this is a huge disturbance of your balanced hormone system, so that may be the reason develop breast cancer. Night shift. There's a lot of people think that it's very important for the risk of breast cancer. 6 out of 10 studies in this review give significantly association between night shift and risk of breast cancer. Nurses, radio telephone operators, flight attendants, or women employed in enterprises, since they have a high tendency working at night. Exposure to light during the night, artificial light, may be causing melatonin, a hormone that's sensitive to light, reduced. So the disturbance of the hormone level, it may be the reason to develop a breast cancer. Alcohol is really dependent on people. Some women maybe have naturally expressed a high level of CYP2E1, and they may be easy to get breast cancer if they drink alcohol. Some women maybe have a lower level of CYP2E1. If they drinking much alcohol, have no effect on their risk to develop breast cancer. Overweight and obesity. Cholesterol is a material of estrogen. Fat cells is not very friendly. Have two reasons. One reason is a factor of produced estrogen, and also a storage for estrogen. So overweight girl taking pills of hormone, and they have two reasons like increase their breast cancer. Eating processed food with high fat, protein, sugar transfer into fat accumulation and let the people grow more fat cells. All of them disturb your endocrine system, especially some food with fried chicken and French fries. Let's get a summary. Higher level of estrogen, strong emotional stimulation, night shift, alcohol, overweight, obesity. They are highly risk factors may trigger off breast cancer. Let's go back to the question in the beginning of this lecture. Who has a more tendency to develop breast cancer? A mom refused breastfeeding in her newly born baby. Breastfeeding could prevent breast cancer. A lady taking birth control pill doesn't want to get pregnant before 40. It is two reasons. One reason is outside hormone pills. Another reason is too late to get her first baby. Highly recommend get pregnant in younger age will be prevent breast cancer. A middle-aged nurse has been through emotional trauma like divorce. Nurse is night shift work, and emotional trauma have a huge impact on the endocrine system. There are two reasons to cause breast cancer. Overweight girl take birth control pill to treat dysmenorrhea. Overweight girl have more fat cells. Taking birth control pills increasing the level of estrogen in her body. Flight attendant is taking HRT for her perimenopause issue. Flight attendant may be a night shift work, and HRT is actual estrogen, make her high level of estrogen in her body. That's all of them a problem to causing breast cancer. Thank you very much. I think you know the reason of breast cancer. Let's prevent it. Bye bye.